Hello, beautiful people, and welcome back to Skin Fiction, where we debunk skin myths and provide you with only skin facts. I'm Dr. Dima Ali. I'm double board certified in cosmetic laser surgery and anti-aging medicine. I also have a skincare line called Cosmetology. I absolutely love empowering people to look and feel their best. So let's get your inner glow and outer radiance to shine bright. I'm Dr. Dima, your favorite cosmetic laser surgeon, but today you can call me the hoo-ha healer. In this episode, we will dive deep into a sensitive topic that many women face, vaginismus. We'll talk about what vaginismus is, its causes and symptoms, and some treatment options for vaginismus, including one very effective treatment that many of you will not be expecting. This treatment has earned me my title, the hoo-ha healer. So let's unpack all of this, and don't worry because no topic is off limits here. The views expressed in this video, though, are my own and don't constitute medical advice. So always consult with a qualified healthcare provider for any medical concerns or conditions. All right, let's kick things off with the basics. What is vaginismus? In straightforward terms, it's when the vaginal muscles tighten involuntarily during penetration. And I don't mean just sexual penetration. Even putting a tampon in is impossible. So imagine you're at a concert, and just when you think you're about to dive into the mosh pit, the bouncer steps in and says, "Not tonight, sweetheart." That's vaginismus throwing up a bouncer in your intimate moments. Vaginismus is an involuntary protective response to vaginal penetration. With this condition, women experience an intense tightening of the pelvic floor in anticipation of vaginal penetration. This is not solely a psychological condition, folks. It can trigger intense physical pain. It affects more women than you think, and many are too timid to talk about it. Primary and secondary vaginismus are the two main classifications of this condition. With primary vaginismus, symptoms appear during a woman's first attempts at sex or even at using a tampon. Secondary vaginismus, on the other hand, is acquired over time, often due to hormonal shifts, recurring infections, surgery, trauma, or even childbirth. Now, how does one end up with this unwelcome visitor? It can result from anxiety, past trauma, even just the pressure of thinking about having an intimate moment. It's like your body gets the memo that this is serious business and decides to shut down. It's not uncommon, and it can be one of the most frustrating and debilitating things a woman experiences. Just yesterday, we had a call from a patient who can only have a GYN exam under sedation. So imagine if you couldn't use your hoo-ha as it was intended to be used unless you're asleep. That's no fun. If you're experiencing vaginal muscle contractions or spasms that feel completely out of your control, you might be dealing with vaginismus. Many women with vaginismus also show protective behaviors like clenching muscles throughout their body, especially when it comes to activities like sex. It's your body's way of trying to protect itself, but it can lead to a lot of frustration and discomfort. Symptoms vary, but they often include pain during penetration, burning sensations, a general fear of intimacy. It's like your body suddenly decides to hit the emergency brake right when things are about to get spicy. Believe it or not, I have married couples that experience this. They got married and they've never had penetrative sex. You must have an amazing personality. Fortunately, there are treatment options available. These include pelvic floor physical therapy, which is where you learn to relax those muscles. Think of it as Zen retreat for your vagina. I'm not doing vaginal yoga here. Okay, next up are dilators. Now, don't panic, these aren't as scary as they sound. We'll show you some pictures of some here. They sort of look like eggs. Some are made out of jade. Think of them as your vagina's training wheels. Gradually introducing them can help ease discomfort and promote relaxation. It's all about baby steps. Nobody's expecting you to win a marathon right out of the gate. Take it slow. Soon you'll be cruising like a pro. Sometimes women have tried the therapy and the dilators and they're just not working as they had hoped. That brings me to the star of this video and one of the treatments that earned me the name the hoo-ha healer. It's called Vtox or Vaginal Botox. Yes, this is a real thing. I consider it a cure for vaginismus. Before we start the procedure, I apply topical anesthetic to ensure you're comfortable. Most patients report feeling very little, if anything at all. Then I use a local anesthesia that I inject with a very small needle. After this is done, I'm able to use my finger to enter the vagina without any discomfort. Then, during the actual procedure, I inject Botox directly into the pelvic floor muscles, more specifically the pubococcygeus muscles, and around the introitus, the opening of the vagina. This helps those muscles relax, almost like giving them a mini vacation. The treatment is completed within 15 to 20 minutes or less, and typically 100 to 200 units of Botox is used. But each hoo-ha varies. What doesn't vary, though, are the results. They are very consistent. In about 2 to 3 weeks, the Botox will be in full effect and start to fade within 3 to 4 months. I recommend patients to begin using their dilators, starting with the smaller sizes and working up. It's not unusual for women to only need one of these treatments. Yes, you may only need one Botox treatment session to resolve your vaginismus symptoms. During that time, penetration during intercourse is comfortable, if not pain-free. Our patients tell us things like, "This procedure was life-changing." This treatment not only helps reduce muscle spasms, but can also make intimate moments more enjoyable. Many patients report a significant change, feeling like they've unlocked a new level in their love life, like going from playing in the kiddie pool to diving into the deep end. So, give your V that VIP upgrade. Let's summarize what Botox can do. Botox works by temporarily paralyzing the muscles into which it's injected, which helps relax the pelvic floor muscles, making penetration more comfortable. By alleviating this muscle tension, you improve sexual comfort and enjoyment, leading to enhanced intimacy and overall quality of life, because sex is important. These treatments are minimally invasive and can be done conveniently in a clinic setting, often with little to no downtime. Botox can be done in conjunction with the other therapies mentioned, such as pelvic floor physical therapy, counseling, or dilators for a more comprehensive, holistic approach to treating vaginismus. It works fast. Patients often experience relief from symptoms within days to weeks after the injections. While the effects of the treatment are not permanent, they can last several months, providing sustained relief, and sometimes it's a one-and-done treatment. If you're dealing with symptoms of vaginismus or curious about vaginal rejuvenation, don't hesitate to reach out to us. Remember, knowledge is power, and I'm here to help. It's essential for patients to discuss this option with a healthcare provider who specializes in sexual health to determine if it's the right choice for them. If you enjoyed this video, give it a thumbs up, subscribe, and hit that notification bell for more episodes of Skin Fiction. Until next time, take care of yourself, and especially take care of your vajayjay.